When my 70-year-old father Robert told his doctor he was going to stop taking his 5 daily medications, Dr. Martinez looked concerned and warned him about the risks. "I've been taking pills for 15 years and I don't feel any better," Robert sighed. "I want to try a different approach." 1 year later, at his annual checkup, Dr. Martinez stared at Robert's test results in disbelief. His blood pressure was normal, his cholesterol had dropped significantly, and his energy levels were better than they'd been in decades. What Robert did instead of taking medication changed everything. Important disclaimer: this story is about one person's experience and should never replace professional medical advice. Anyone considering changes to their medication regimen should work closely with their healthcare provider. Robert's journey was medically supervised and may not be appropriate for everyone. This is the story of how my father transformed his health at 70 by questioning conventional treatment and working with his doctor to find a better way. It's about the power of lifestyle changes, the courage to challenge the status quo, and the importance of advocating for your own health at any age. Robert's medical history. By age 70, my father Robert had accumulated what seemed like a pharmacy's worth of daily medications. His morning routine included pills for high blood pressure, high cholesterol, type 2 diabetes, acid reflux, and arthritis pain. His evening routine added more medications for sleep and additional blood pressure control. Robert's health decline had been gradual. It started in his mid-50s with a diagnosis of high blood pressure during a routine physical. "No big deal," his doctor had said at the time. "We'll just put you on a low-dose medication to keep it under control." Over the years, additional health issues emerged, each one treated with another prescription. High cholesterol appeared in his early 60s, followed by type 2 diabetes, then chronic acid reflux from the medications, and finally arthritis pain that seemed to worsen with age. Each new prescription came with its own side effects, which sometimes required additional medications to manage. Robert was taking acid reflux medication because his blood pressure pills upset his stomach. He needed sleep aids because some of his medications caused insomnia. He required stool softeners because his pain medication caused constipation. "I felt like I was in a medical hamster wheel," Robert told me recently. Every solution created a new problem that needed another solution. By 70, Robert's daily medication routine looked like this. Morning: blood pressure medication, cholesterol medication, diabetes medication, acid reflux medication. Evening: second blood pressure medication, sleep aid, arthritis pain medication as needed, additional pain relievers, stool softeners, antacids. Despite this comprehensive medication regimen, Robert didn't feel healthy. In fact, he felt worse than ever. The turning point came during a particularly difficult week when Robert experienced what seemed like a cascade of medication side effects. The new arthritis medication his doctor had prescribed was causing severe stomach upset, despite taking it with food and additional acid reducers. The stomach problems were keeping him awake at night, which meant he needed stronger sleep aids, which left him groggy and confused the next day. "I realized I was spending more time managing my medications and their side effects than I was actually living my life," Robert said. "I had become a full-time patient instead of a person who happened to have some health issues." Robert began researching his conditions and medications online, something his doctor had always discouraged. What he found surprised him. Many of his health issues seemed to be interconnected, and several appeared to be lifestyle-related rather than purely genetic or age-related. He discovered that type 2 diabetes could often be managed or even reversed through diet and exercise. He learned that high blood pressure frequently responded to stress reduction, weight loss, and dietary changes. He found studies showing that some cholesterol medications might not be as beneficial for people his age as originally thought. Most importantly, Robert discovered that many people had successfully reduced or eliminated their medications through lifestyle changes, but always under medical supervision. Robert had been seeing Dr. Martinez for 8 years, and he respected his doctor's expertise. But he also felt that their relationship had become focused on managing medications rather than optimizing health. "I want to have an honest conversation about whether all these medications are really necessary," Robert told Dr. Martinez during a routine appointment. I feel worse now than I did before I started taking most of them." Dr. Martinez listened carefully as Robert described his concerns about side effects, drug interactions, and overall quality of life. He explained his research into lifestyle interventions and his desire to try a different approach. "I understand your concerns," Dr. Martinez said. "But stopping medications abruptly can be dangerous, especially for conditions like high blood pressure and diabetes. If you're serious about this, we need to do it very carefully and gradually." Dr. Martinez proposed a compromise. They would work together to reduce Robert's medications slowly while implementing lifestyle changes. If Robert's health markers remained stable or improved, they could continue the process. If anything got worse, they would resume the previous treatment plan. "The key," Dr. Martinez explained, "is close monitoring and gradual changes. We're not abandoning medical care, we're just trying a different approach to achieving the same health goals." The plan Robert and Dr. Martinez developed a comprehensive plan that would address his health issues through lifestyle changes while gradually reducing medications. The plan included dietary changes, elimination of processed foods and added sugars, focus on whole foods, vegetables, lean proteins, and healthy fats, portion control, and regular meal timing. Significant reduction in sodium intake, exercise program, daily walking, starting with 15 minutes and gradually increasing light strength training twice a week, yoga, or stretching for flexibility and stress reduction. Stress management, meditation practice starting with 5 minutes daily, better sleep hygiene, reduction of news and social media consumption, more time spent on hobbies and social activities, medication reduction protocol, gradual reduction of one medication at a time weekly, blood pressure and blood sugar monitoring, monthly blood tests to check cholesterol and other markers, immediate resumption of medications if any concerning changes occurred. Dr. Martinez emphasized that this was an experiment, not a guaranteed outcome. "Some people respond very well to lifestyle interventions," he said. "Others need medications to maintain their health. We won't know which category you're in until we try." The first 3 months, Robert began his lifestyle changes immediately while continuing all his medications. He wanted to establish new habits before starting to reduce any prescriptions. The dietary changes were the most challenging initially. Robert had been eating a fairly typical American diet, not terrible, but not optimized for health. Eliminating processed foods meant cooking more meals at home and learning to read nutrition labels carefully. "I hadn't realized how much sodium was in everything I was eating," Robert said. "Just by cooking my own meals and avoiding packaged foods, I was probably cutting my sodium intake in half." The exercise program started slowly. Robert began with 15-minute walks around his neighborhood, gradually increasing to 30 minutes daily. He joined a local gym that offered senior-friendly strength training classes and began attending twice a week. Perhaps most surprisingly to Robert, the stress management components had immediate benefits. "I didn't think I was particularly stressed," he said. "But when I started meditating and paying attention to my stress levels, I realized I was carrying a lot of tension without noticing it." After 3 months of lifestyle changes while maintaining his medications, Robert's health markers had already improved significantly. His blood pressure readings were consistently lower, his blood sugar levels were more stable, and he had lost 12 pounds without trying to diet specifically for weight loss. Dr. Martinez was impressed with the results. "Your body is responding very well to these changes," he said. "I think we can start reducing some medications and see how you do." The medication reduction process took another 6 months and required careful monitoring. Dr. Martinez started with the medications that were easiest to stop safely and had the most bothersome side effects. Month 4. Acid reflux medication. The first medication eliminated was the acid reflux medication. Robert's dietary changes had eliminated most of his stomach problems, and stopping this medication actually improved his digestion. Month 5. Sleep aids with better stress management and regular exercise. Robert's natural sleep patterns had improved significantly. The sleep aids were discontinued with no negative effects. Month 6. Pain medication. Regular exercise and weight loss had reduced Robert's arthritis pain considerably. He was able to stop taking daily pain medication. using only occasional over-the-counter relief as needed. Month 7 to 8. Blood pressure medications. This was the most carefully monitored reduction. Robert's blood pressure had been consistently normal for 2 months, so Dr. Martinez gradually reduced and then eliminated his blood pressure medications while monitoring daily readings. Month 9. Diabetes. Medication with dietary changes and weight loss. Robert's blood sugar levels had normalized. Dr. Martinez reduced and then eliminated his diabetes medication while Robert continued monitoring his blood sugar daily. Month 10. Cholesterol medication. The final medication to be eliminated was the cholesterol medication. Robert's cholesterol levels had improved significantly with dietary changes and exercise, making the medication unnecessary. Throughout this process, Robert had weekly check-ins with Dr. Martinez and monthly blood tests. Any concerning changes would have resulted in resuming medications immediately, but Robert's health markers continued to improve. The 1-year results at Robert's 1-year follow-up appointment. Dr. Martinez reviewed a year's worth of health data with obvious amazement. "These results are remarkable," Dr. Martinez said, comparing Robert's current numbers to his baseline from a year earlier. "Your blood pressure is not just normal, it's optimal. Your cholesterol profile has improved dramatically. Your blood sugar levels are in the normal range. And you've lost 25 pounds. But the improvements went beyond just numbers. Robert reported having more energy than he'd had in years. His sleep quality was excellent without medication. His digestion was normal. His joint pain was minimal and manageable with occasional over-the-counter medication. I feel like I've turned back the clock 10 years, Robert said. But more importantly, I feel like I'm actually healthy now, not just managing sickness." Dr. Martinez admitted that Robert's results had changed his own approach to treating similar patients. "I've always known that lifestyle changes were important," he said. "But seeing Robert's transformation has made me much more aggressive about recommending lifestyle interventions before adding more medications." What Robert did differently. Robert's success wasn't based on any single dramatic change, but rather on consistent implementation of several evidence-based lifestyle modifications. Nutrition changes, eliminated processed foods, and added sugars focused on whole foods, vegetables, fruits, lean proteins. Whole grains reduced sodium intake dramatically by cooking at home. Practiced portion control and mindful eating, limited alcohol consumption to occasional social drinking, physical activity, daily walks of 45 to 60-minute strength training twice a week, with focus on functional movements, yoga, or stretching daily for flexibility and stress reduction. Increased overall daily movement stress management, daily meditation practice, working up to 20 minutes, improved sleep hygiene, reduced news consumption, and social media use. Increased social activities and hobby time, regular outdoor time in nature, medical monitoring, weekly blood pressure and blood sugar monitoring, monthly blood tests during medication reduction phase, regular communication with healthcare provider, immediate medical attention for any concerning symptoms. Important considerations. Robert's success story comes with important caveats that anyone considering a similar approach should understand. Medical supervision is essential. Robert's medication reduction was supervised by his doctor and involved extensive monitoring. Stopping medications without medical supervision can be dangerous or life-threatening. Individual results vary. Not everyone will respond to lifestyle changes the way Robert did. Some people have genetic factors or advanced disease that requires medication management regardless of lifestyle. Time and commitment required. Robert's transformation took a full year and required significant lifestyle changes that he maintains daily. This isn't a quick fix or temporary intervention. Not all conditions are lifestyle related. Some health conditions require medication, regardless of lifestyle factors. Robert's conditions happen to be responsive to lifestyle interventions, but this isn't true for all medical issues. Final thoughts. Robert's journey from taking 5 daily medications to taking none while improving his health markers is remarkable, but it's not a universal prescription for everyone. His story is valuable because it shows that significant health improvements are possible through lifestyle changes, even later in life, but always under proper medical supervision. "I wish I had known 15 years ago what I know now," Robert said. Recently, but I'm grateful I learned it at 70 instead of never learning it at all. It's never too late to take control of your health. Remember, this story is one person's experience and should not be considered medical advice. Always consult with your healthcare provider before making any changes to your medication, regimen, or treatment plan. Thank you for joining us in Robert's inspiring journey. If you've had similar experiences with lifestyle changes and health improvements, or if you have questions about advocating for your own health, please share them in the comments below. What questions do you have about working with your healthcare provider to explore all treatment options? Remember, the goal is always optimal health through the safest, most effective approach for your individual situation.